then suddenly I feel very tight on my body. It's very, very tight until it's like want to suffocate you. So I was quite worried. Then once you are worried, I will trigger my anxiety, you know. So I feel like vomiting. I feel like I'm going to die soon, you know. I'm Kelvin, I'm 49, I'm a property agent, and I was diagnosed with cervical spinal cord injury in 2022, July. So back then was a bit challenging. I also have a lot of viewings in the afternoon, in the day, in the morning, in the night. So when I'm back home was like, it's like 8, 9 p.m. So every dinner was cold. The food was cold, yeah. Yeah, so that's my life for my journey in 2022. Yeah, because in our real estate business, right, we always want to achieve a greater height because your colleague might be doing better and you want to chase that kind of glory. So for me, I'm a competitor person. Actually, in 2022, I was quite active with my exercise. I went gym, I go hiking. I can hike for like 8 km to 10 km almost every week. Almost every week, yeah. So I went to Bukit Timah Reserve to do my hiking. And I also like very actively walking back at my condo, which actually linked to Labrador Park. So I actually walk 4 times. It's about 10 km, you know. So this is my life in 2022. I want to exercise and keep fit. So I didn't know this happened to me, you know. So I was quite sad, yeah. I have a very bad electricity all over my body, from the leg to my hand. I find it quite weird. How come I have this kind of, in Chinese we call 电流. Yeah, so I was quite worried. I told my wife, would that be something happen to me after this? He said, you rest for a while, maybe she put me in the bed. So I was still having this kind of electricity shock. So I was quite worried. So then suddenly I feel very tight on my body. It's very, very tight until it's like want to suffocate you. So I was quite worried. Then once you are worried, I will trigger my anxiety, you know. So I feel like vomiting. I feel like I'm going to die soon, you know. So I told my wife, let's go to the hospital. I've been seeing this doctor called Dr. Prof. Wong from NUH. So back then she's actually taking care of my sleep disc. So they call him and he say maybe let me go home first because he's on so-called on leave or something like that. So they actually asked me to go back. So when I go back, I feel something is wrong, like my legs are warping. You know, it cannot control your leg. So when you move right, you will like make that you will swing a few times before I can walk. So I went to the clinic on the next morning, and he actually expedited the MRI for me. So then cut the story short, right? So after the MRI, he noticed that I have a cyst in front of my C4 or C5. So he said the surgery have to be paused first before I have to do a checkup on my cyst and see what is happening. So that is like, wow, you know, this thing haven't solved, another thing happened again. Because in my thinking is like I want to do my surgery immediately and I want to walk immediately. But this thing happened like out of a sudden, I was quite worried. How come there's a cyst in front of my C4 spine? So we went to the ENT, and the ENT doctor, I can't remember his name, but he told me that the cyst is not growing, but we have to monitor. But to me, it's like, monitor for how long? I can't walk actually. Then now my tightness in my body, I need the surgery ASAP. So no choice, I have to bring my walking stick throughout these 2 months. 2 months, then we will go for my surgery. So actually, to be honest, the attack was my wife's birthday, 3rd July. I was in the hospital because I got no choice. Her birthday, we will celebrate in the hospital. So the operation lasts about 7 hours, but it was overrun for 1 hour. So my wife outside the operating theater was very worried. She was like running up and down to look for the nurse and checking what's happening. How come the doctor say 7 hours will be done? But it was like dragging. She has no contact to look for, what's happening inside the theater. The operation he actually cut my throat here, just slightly above the throat, and he actually tear I don't know what he did. I think he tear and make big the airwell here, so that he can enter into the spine to put the implant on my spine. The implant it's actually 4 channel, C4, 5, 6, 7. 8 was the last. So it's long. It's actually quite long. The implant is just behind my throat, behind my throat. So he said this surgery actually a bit of risk, because most of the time the patient he did was through behind. Because I can't do behind because my spine actually pushed back to the spinal cord. So it's quite dangerous to do that. So you need to operate slowly from the front. So he put an implant here. So when I wake up, I cry all the way. It's actually very painful. Honestly, it's very, very, very painful. I cry all the way, and the next morning I was having breakfast, talking with my relative. So all of a sudden I was like fainted. So the nurse came out to help to put me on the bed again. So we asked the doctor why I suddenly like fainted, all of a sudden. So he said it could be the nerve linked to the brain or something like that causes I going to faint. So if I don't do the surgery, you will be paralyzed for life. So it's deteriorating because the spine actually pushed back to the spinal cord. So it's like a V shape. So push all the way from C4 to C8, push all the way to the cord, and it damaged the cord. That's why you make me can't walk properly, and in fact, when I was discharged from the hospital, the first breakfast at home was a terrible breakfast in my life, because I was feeling the metal plate in front of my throat. I can feel the metal plate in front of my throat. Definitely you can feel. No lie, it's just that nobody can understand, seriously. Even the doctor also can't really tell you whether you can feel it or not. But it's like something inside your throat. You are struggling to remove it because it's so uncomfortable. You make you wanted to faint, Really, really want to faint because it's very uncomfortable. So I cried the whole morning. I told my wife, ask the doctor to bring out the metal plate for me. She said, why don't you lie down first? You are maybe just cool down, relax. But of course, cool down, relax can help lah. But really is very torturing for me, seriously. I took about 1 year to recover. And during that time, right, when I was, I hate the feeling, seriously. I was taking my, the walking stick, right, to go for my viewing, with my wife. She actually went for, she's not a property agent, but she wanted to help because I can't even walk to the stairs, up to the stairs. And there's one incident, and we met with this owner who actually wanted to sell the landed property. I can feel that she has a different thought of me, seriously. And I know that she wants somebody that is strong enough to take care of his property, not a person who taking a walking stick to actually sell his house, sell a house. So I know the feeling. I was very sad. Seriously, I'm very down and sad throughout this recovery stage. Last for 1 year. So I told myself one day, I can't be like this, correct or not? So I throw away the walking stick. I pass it to my dad. My dad said, "Hey, I swear like this stick, pass to me." He also end up throw away, So I told myself, I can't walk with a walking stick. No way, especially in my job. So I started to walk without the stick. The balancing was okay initially, but when you are fatigued, right, I tell you, it's terrible because the whole body is tight. The doctor actually told me that whatever happens before the surgery, right, it will be there. The tightness of your body, the numbness of your hand, the leg, all will be there because the only thing it can help you is to walk. So this tightness, when I'm talking to you right now, is still very tight. And when it's very tight, right, you cannot even breathe well. And if you cannot breathe well, my anxiety will come. So what will happen? I will feel very giddy and wanted to sit down or even lie down. Yeah. So got one time, right, there's one incident also very funny. I went for a viewing with my own, this time no walking stick. I went to do a viewing. I was early, I was in the car, and all of a sudden I feel I can't really stand up because I have a very bad giddy. I was giddy throughout the whole journey driving to the condo. And I was sitting in the car and I thought that maybe this 15 hours I'm early, I can just drink a lot of water and go toilet, but I can't even walk properly. I feel very giddy and I activate my wife to come. And we actually was sent to hospital for that moment. And the viewer was also very worried. Are you okay? Because I WhatsApp there, said, I'm in the car actually, I cannot move, I want to vomit, I want to faint, style of thing. So this is the one incident that actually remind me that seriously, I have to take life easy now. She's my walking stick, she's my walking stick, seriously. I feel that I owe her a lot, seriously. I want to let her know that I really love her. I want to take this opportunity that we can build the family together and just be happy throughout our life. Yeah. So in fact, the only person with me is my wife. When you are down until today, it's still her.